Hello, nursing fans. Thank you for joining us for part 2 of Chapter 11, Nursing Care of Patients with Cancer. Okay, this is on page 152. Contrast media X-ray studies are used to determine or to detect abnormalities that might not show up with regular X-rays. Barium is given orally for visualization of the esophagus and stomach. It can also be given rectally as a barium enema for visualization of the colon. Intravenous injection of contrast media is used for visualizing the vessels, the urinary tract, or fallopian tubes. CT scans are important in the diagnosis and staging of malignancies. They can detect minor variations in tissue thickness. The use of a contrast medium enhances the accuracy of an abdominal CT scan. CT scans are also used to improve the accuracy of inserting a fine needle for biopsy. Be sure to assess the patient for a history of allergic reaction to dyes and for kidney function. Dyes are excreted by the kidneys. Nuclear medicine imaging involves camera imaging of organs or tissues containing radioactive media. Radioactive compounds are given intravenously or by mouth. These studies are highly sensitive. They can detect sites of abnormal cell growth months before changes are seen on an X-ray. Positron emission tomography, PET scanning, provides information about cellular function. Patients are given biochemical compounds. Images are made of the tissue through gamma camera tomography. PET scans have been useful in brain imaging as well as the detection of the spread of cancers of the lung, ovaries, colon, rectum, and breast. Ultrasound procedures. Ultrasonography helps detect tumors of the pelvis and breast. Ultrasound also may be used to distinguish between benign and malignant breast tumors. Magnetic resonance imaging, MRI, is valuable in the detection, localization, and staging of malignant tumors in the central nervous system, spine, head, breast, and musculoskeletal system. Endoscopic procedures. An endoscopic examination allows the direct visualization of a body cavity or opening. Endoscopy enables the surgeon to biopsy tissue. It is used to detect lesions of the throat, esophagus, stomach, colon, and lungs. Laboratory tests. For normal values for the following laboratory tests, see Appendix B. Blood, serum, and urine tests are important in establishing baseline values and general health status. An elevated WBC, or white blood cell count, is expected if the patient has evidence of infection. However, an increase in WBCs without infection raises suspicion of leukemia. 50% of patients with liver cancer have increased levels of bilirubin, alkaline phosphatase, and glutamic oxaloacetic transaminase. Glutamic oxaloacetic transaminase. Bone marrow aspiration is done to learn the number, size, and shape of red blood cells, white blood cells, and platelets. It is a major tool for diagnosis of leukemia. See Chapter 27 of this text For a description of this test and related nursing care, tumor markers, also called biochemical markers, are proteins, antigens, genes, hormones, and enzymes produced and secreted by tumor cells. Tumor markers help confirm a diagnosis of cancer, detect cancer origin, monitor the effect of cancer therapy, and determine cancer remission. Some examples of tumor markers are shown in Table 11.3. Cytological study. Cytology is the study of the formation, structure, and function of cells. Cytological diagnosis of cancer is obtained mainly through smears of cells shed from a mucous membrane, e.g., cervical, anal, oral. Test results are based on the degree of cell abnormality. Slight cellular changes are considered normal, with a possible link to abnormal cells seen in infection. Significant cellular changes reflect a higher probability of precancerous or cancerous activity. So this tumor marker AFP, which is alpha fetoprotein, is associated with hepatocellular cancer, so liver cancer. Cancer antigen 15-3 is associated with breast cancer, and this is useful in monitoring patient response to therapy for metastatic breast cancer. CA125 is associated with it's associated with ovarian, cervical, liver, and pancreatic cancers. CA19-9 is associated with colorectal, pancreatic, and hepatobiliary cancers. It's used to aid diagnosis and evaluation. Carcinoembryonic antigen, CEA, is associated with colon and rectal cancers. And then for prostate cancer, the tumor markers are PAP, which is prostatic acid phosphatase, or PSA, which is the prostate-specific antigen. Staging and grading. Tumor staging helps to describe the extent of the cancer. This provides valuable information for the development of a treatment plan. The most common system used for staging is the tumor node metastasis (TNM) system, recommended by the American Joint Committee on Cancer. This staging system classifies solid tumors by size and degree of spread. For example, a breast cancer staged as T3N2MO is a large breast cancer that is spread to regional lymph nodes with no distal metastasis. The TNM ratings correspond with one of 5 categories. However, ratings may differ based on the type of cancer. In this classification system, stages range from 0, tumor in situ, no invasion to other tissues, to stage 4, which is distant metastasis to other sites. In general, a lower stage number means the cancer is less advanced and offers a better outcome. A higher number means a more serious situation exists, but treatment is possible. A rating system has also been established to define the cell types of tumors. Tumors are classified according to the percentage of cells that are differentiated or mature. If the tissue of a neoplastic tumor closely resembles normal tissue, it is called well differentiated. A poorly differentiated tumor is a malignant neoplasm that contains some normal cells, but most of the cells are abnormal. The better defined or differentiated the tumor, the easier it is to treat. For more information on staging systems, visit cancerstaging.org. So table 11.4 is the tumor node metastasis system for cancer staging. And as the slide states, it's an international system that allows comparison of statistics among cancer centers. This staging system classifies solid tumors by size and degree of spread. So a primary tumor TX means the primary tumor cannot be evaluated. TO means there's no evidence of primary tumor. TIS would be carcinoma in situ. This is early cancer that is not spread to neighboring tissue. From there, there's T1, T2, T3, and T4, which are the size or extent of the primary tumor. NX means the regional lymph nodes cannot be evaluated. NO means no regional lymph node involvement. N1, N2, or N3 means involvement of regional lymph nodes, number and location of lymph nodes. And then distance metastasis is either MO for no distant metastasis or MI for distance metastasis. Treatment for cancer. There are three main types of treatment for cancer: surgery, radiation therapy, and chemotherapy. To find out more about cancer treatment options, visit the ACS website at cancer.org. Surgery. Surgery can be curative when it is possible to remove the entire tumor. Skin cancers and well-defined tumors without metastasis can be removed without any additional intervention. For some tumors, as much of the tumor is removed as possible. Debulking. Follow-up chemotherapy or radiation is used to treat the remaining tumor cells. Prophylactic surgery is used to remove moles or lesions that have the potential to become malignant. Colon polyps are often removed to prevent malignancies from developing, especially if the polyps are considered pre-malignant. An extreme example of prophylactic surgery is a woman who elects to have a mastectomy, surgical removal of the breast, because of a high incidence of breast cancer in her family or positive genetic testing. Surgery also may be done for palliation or symptom control. Surgical removal of breast tissue to reduce the size of the tumor mass is helpful, especially if the tumor is compressing nerves or blocking the passage of body fluids. The goal of palliative surgery are to increase comfort and quality of life. Reconstructive surgery can be done for cosmetic enhancement or for return of function of a body part. Facial reconstruction is important for the patient's self-image after removal of head or neck tumors. Women can elect to have breast reconstruction after mastectomy. Nurses should encourage patients to express their fears. Patients with a limited understanding of cancer may fear that tissues will not heal post-operatively. Provide information about wound care, including dressing changes and drainage tubes, to increase the patient's understanding and sense of control. Visual aids concerning tumor site and surgical procedures are valuable teaching tools. Include family members or caretakers in teaching when possible. Patients who are undernourished are poor surgical candidates. They require interventions such as enteral or parenteral nutrition before and after surgery. Patients with cancer also are at increased risk for postoperative DVT, deep vein thrombosis. Preoperative teaching includes the importance of leg movement, early ambulation, wearing anti-embolism stockings, and recognizing symptoms of DVT such as calf redness, warmth, or pain. Radiation. Radiation may be used as a curative treatment if the cancer is localized. It can also be useful in cancer control and palliation. Radiation destroys cancer cells by affecting cell structure and the cell environment. The decision to use radiation is commonly based on cancer site and size. Treatments use special equipment to send radiation to break up the cancer cells locally, causing little systemic effect. However, side effects can occur in the area being treated because of damage to normal cells. Radiation can be delivered in three ways: external radiation, internal radiation, brachytherapy, or systemic radiation, ACS. Radiation can be used before surgery to decrease the size of a large tumor. This makes surgical intervention more effective and less dangerous. It can also be used after surgery as adjuvant treatment. Palliative radiation is used to reduce the size of a large cancerous lesion and consequently reduce pressure and pain. Radioisotopes can be inserted into or near cancerous tissue, brachytherapy, during or after surgery to help destroy cancerous cells without removing the organ. Less skin damage occurs with brachytherapy. Nursing care of the patient receiving radiation treatment. Symptoms of tissue reaction to radiation can be expected about 10 to 14 days after treatment starts. Symptoms can continue for up to 2 to 4 weeks after treatment ends. Typical reactions and appropriate nursing interventions include the following: fatigue. Encourage the patient to nap often and prioritize activities. Reassure the patient that the feeling will go away after the treatments are completed. Nausea, vomiting, and anorexia. Encourage the patient to take the prescribed medication for nausea and vomiting. Anorexia can be eased by providing small amounts of high carbohydrate, high protein foods and avoiding foods high in fiber. Mucositis, inflammation of mucous membranes, especially of the mouth and throat. Urge the patient to avoid irritants such as smoking, alcohol, acidic foods and or drinks, extremely hot or cold foods, and drinks and commercial mouthwash. Advise the patient to perform mouth care before meals and every 3 to 4 hours. A neutral mouthwash can be made by using 1 ounce of diphenhydramine hydrochloride, which is Benadryl elixir diluted in 1 quart of water or normal saline solution. Agents that coat the mouth, such as calcium carbonate or Maalox, are sometimes used. Lidocaine hydrochloride, 2% viscous, has an aesthetic effect on the mouth and throat. Xerostomia or dry mouth. Encourage frequent mouth care. Saliva substitute is available over the counter. It is helpful, especially at night when patients describe a choking sensation from extreme dryness. Skin reactions. These can vary from mild redness to moist desquamation or peeling skin, similar to a second-degree burn. Skin surfaces that are warm and moist, such as the groin, perineum, and axillae, are especially vulnerable. Prophylactic skin care includes keeping skin dry, keeping it free from irritants such as powder, lotions, deodorants, and restrictive clothing, and protecting it from exposure to direct sunlight. Irradiated skin can be fragile during treatment. It is important to wash these areas gently with mild soap and water. Rinse well and pat dry. The skin may have markings or tattoos to delineate the treatment field. Take care not to wash off the markings. Of course, the tattoos you don't have to worry about. But bone marrow depression, low blood cell counts occur with both radiation and chemotherapy. This is because they can attack all rapidly dividing cells, not just cancer cells. Weekly blood cell counts are done to detect low levels of WBCs, RBCs, and platelets. Transfusions of whole blood, platelets, or other blood components may be needed. See Table 11.5 for medications that can be used to stimulate production of blood cells. Safety considerations. Radiation may be considered externally or internally. External radiation is given by a trained medical specialist in a designated area of a hospital or clinic. Patients receiving external radiation therapy do not emit radioactive material, therefore they do not require any safety precautions before or after treatment. Colony stimulating factors. Granulocyte colony stimulating factors, GCSF, stimulates the proliferation of stem cells into granulocytes or neutrophils. Examples would be filgrastim, which is Neupogen, and the implications would be to monitor the complete blood count. There is pegfilgrastim, which is Neulasta, and teach subcutaneous administration if the drug will be given at home. Granulocyte macrophage colony stimulating factor, GMCSF, stimulates the proliferation of stem cells into neutrophils, monocytes, macrophages, and eosinophils. Examples include sargramostim, which is leucine, and the nursing implications for leukine would be monitor vital signs and respiratory status during intravenous infusion, monitor the complete blood count, and teach subcutaneous administration if the drug will be given at home. Erythropoietin stimulates proliferation of stem cells into red blood cells. There's epoetin alpha, which is Epogen or Procrit, and then darbepoetin alpha, Aranis. Nursing implications, black box warning for heart disease risk. Monitor blood pressure and hematocrit. Teach subcutaneous administration if the drug will be given at home. And darbepoetin alpha, Aranis, is long-acting. Interleukin 11 stimulates the production of platelets. Examples would be oprelvecin or Numega. Nursing implications include watch for fluid retention, monitor CBC and platelet count, and teach subcutaneous administration if the drug will be given at home. Note, because these drugs are proteins, they all require refrigeration, and you cannot shake them. Many thousands of dollars have been lost because a drug was not returned to the refrigerator when it was not used. Be sure to check package instructions. Internal radiation is administered to patients admitted to a healthcare facility. Safety guidelines must be followed when caring for a patient with internal radioactive materials that have been implanted into tissue or body cavities or administered orally or intravenously because the patient will be radioactive. Nursing responsibilities include knowledge about the following: the radiation source being used, the method of administration, the start of treatment, the length of treatment, and the prescribed nursing precautions. Personnel involved with radiation therapy must follow three limitations to protect themselves: time, distance, and shielding. These three factors depend on the type of radiation used. Time involves the time spent administering care. Distance involves the amount of space between the radioisotope and the nurse. Shielding involves the use of a barrier, such as a lead apron. You must work efficiently when caring for patients who are receiving radioisotopes that are releasing gamma rays. Your exposure to radiation is proportionate to the time spent and the distance from the radiation source. For example, you will receive less exposure standing at the foot of the bed of a patient with radioisotopes inserted into the head than if you stand at the head of the bed. Principles of time and distance are used to protect the nurse, visitors, and other personnel. It is important to teach the patient and family members the reason nursing care focuses on providing only essential care. Speedy nursing encounters and visitor restrictions are better accepted and less likely to promote feelings of isolation when the patient and family understand the reasons behind them. Drainage from the site of a radioactive colloid injection is also considered radioactive. The HCP must be informed immediately if it occurs. Dressings contaminated with radioactive seepage must be removed with long-handled forceps. Radioactive materials must never be touched with unprotected hands. Shielding is required to prevent exposure to radiation. Contamination from radioisotope applicators or interstitial implants cannot occur when the capsule it is contained in is intact. Contamination occurs when the capsule is broken. Be safe. Be vigilant. Remember to use the principles of time, distance, and shielding to protect yourself from radiation exposure. So now we're going to watch this video.
Talk to them about what it's going to feel like, if it's going to be any discomfort, what to expect from the injection. Sometimes it's a warm flush feeling. My name is Lisa Blevins. I'm a registered nurse here at GBMC. I work in the radiation oncology department. The radiation oncology nurses help patients through the side effects of radiation therapy. We have patients that come in for a variety of reasons. Folks that come in for follow-up. These are patients that have been treated in the past, probably up to 3 months ago. They're coming in for checkups. We're checking their skin, we're checking their vital signs, we're checking to see how they're doing with coming off of treatment. Are they less tired? Is their skin improving? Are they able to eat and drink and things like that? Then we have our folks that come in daily for treatment. They're coming in each day, getting their treatment. They're usually here for, we tell them allow an hour each day, but they're on the treatment table about 15 minutes. I hope that I can make their experience here a little bit easier. Some treatments are 5 weeks, some treatments are 7 weeks, some treatments are easy, and some treatments are very, very hard. But if I can encourage the patient, be cheerful, talk to them, make them feel important, and hopefully make their treatment just a little bit easier. Yes, we take care of all the side effects and we take care of, the things that they need medically, but we also need to be there on an emotional level. I just wanted to take a few minutes and talk with you about the side effects of radiation therapy. The most challenging part of my job as a radiation oncology nurse is figuring out where the patient's coming from. Are they scared? Are they okay with things? Is the family struggling? What are the emotional aspects? So I kind of have to find out where they are, what their thinking is, so that we can then educate them so that they can be more comfortable with their treatment. We want to participate with them during their treatment so that we can better care for them. I'm going to take your needle out now. Working with cancer patients has made me understand that life is precious. We don't know how much of life we have or how long of life we have, but to make the best of it and the most of it.
Page 156, chemotherapy. Chemotherapy is a chemical therapy that uses cytotoxic drugs to treat cancer. Cytotoxic drugs can be used to cure, control, or for palliation of cancerous tumors. They are classified according to how they affect cell activity. Examples of drugs are listed in tables 11.6 and 11.7 on page 157, 158, and 159 of the 6th edition. The effects of chemotherapy are systemic unless it is used topically for skin lesions. Chemotherapy is used pre-operatively to shrink tumors and post-operatively to treat residual tumors. Tumor type and genetics influence the effectiveness of chemotherapy. Age is also a consideration. Treatment should be based on physiological age rather than chronological age. That is, just because a patient might be 70 years old does not mean his body is the same as that of other 70-year-old patients. Combination chemotherapy. In this type of therapy, 2 or more antineoplastic agents are used together. This can expose a larger number of cells at different points in the cell cycle to chemotherapy. Combining drugs also allows for smaller doses of each drug. This decreases the side effects of individual drugs and decreases the possibility of the tumor becoming resistant to the therapy. For drugs to be combined this way, several criteria must be met. Each drug must be effective when used alone to treat the cancer. Each must have a different toxicity that would limit its use. For example, 3 drugs that are all toxic to the heart, cardiotoxic, are given. The patient is more likely to develop cardiotoxicity. Patients are still monitored for toxic effects from the treatment as well as improvement in their status. Routes of administration. Chemotherapy can be given by oral, intramuscular, intravenous, or topical route. The dosage is determined by the size of the patient and the toxicities of the drug. IV administration requires specialized training and knowledge of actinoplastic drugs. Vesicant drugs are given only by IV route into a large vein. These drugs cause blistering of tissue that eventually leads to necrosis if they infiltrate or leak out of the blood vessel and into soft tissue. Skin grafts may be needed if tissue damage is extensive. Oral chemotherapy agents. The number of oral chemotherapy agents has increased in the past several years. Be aware that oral agents can be just as potent as chemotherapy administered via the IV route. Nursing considerations for oral chemotherapy include safe storage and handling, as well as side effects to assess for. Some oral agents must be given concurrently with another treatment, such as radiation, so timing is important. Let's take a look at this video.
The chemotherapy comes to us from our pharmacy and they mix the dose. It's made specifically for each patient and it's labeled with their name and their birth date, the exact dose and drug that they're getting. My name is Betty Madsen. I've been a chemo nurse now for about 10 years. Taking care of patients that have cancer, they're in a real scary time of their life. They need someone to kind of take them under their wing, guide them through their treatment. They'll have lots of questions. Some will just start to cry. I'll try to give them a hug or hold their hand, let them know that we'll take good care of you. Even if their diagnosis is looking pretty grim, I still try to encourage them to kind of seize the moment. Try not to be anxious. They certainly didn't sign up for this. No one volunteers for cancer. And I just let them talk and I listen. Some patients say, "Oh, what kind of poison are you giving me?" And I said, "Don't look at it as poison. It's medicine. It's intense, but it has to be to knock out those cancer cells." When I first started, I expected it to be a little more discouraging. It's amazing. I don't see myself working with women that are down and discouraged. I see myself working with women that are really positive, thankful for the life they have, and we kind of can encourage one another. A lot of the women that I've treated over the years are no longer on this earth. It's sad because I know their family really misses them. Because I had one patient, it was obvious her disease was progressing. She came in a wheelchair, didn't have the strength to walk anymore. And she said, do you think I'm going to die? Do you think I'm dying? And I had to look at her and say, you know, it does seem like your cancer is progressing. And we weren't put on this earth to go through stuff alone. We are there for each other. It's special to have that kind of relationship. Thankfully, it's not always bad news. There are success stories and there are women that are living longer. I don't think you can really fully grasp what that would be like until you just are there and start to build a bond with these amazing women. The best day ever is to be able to give people some good news. Most of the women want to know what their CA-125s are, and it's exciting to get excited with them. Research plays a huge part in finding a drug that maybe doesn't have as many side effects, finding a drug that's more targeted towards the cancer cells and not towards healthy cells, finding a drug that'll amp up your own immune system to be able to fight it off. Watching the women go through their journey, I've learned that cancer doesn't have to be so scary. I've learned how to really appreciate life, appreciate each day. Don't spend time worrying about what isn't, because that only robs you of your life that you have today. That's what I've learned.
Okay, table 11.6, and this is on page 157. Some of the anti-tumor antibiotics, they damage cells' deoxyribonucleic acid, the DNA, and the ability to make DNA and ribonucleic acid, RNA. Examples would be doxorubicin, also called adriamycin, and Doxil. The nursing implications. Drug is a vesicant and should be given through a running intravenous IV or a central line. If it is a continuous infusion, it turns urine red. Doxil is less irritating than adriamycin. Monitor cardiac status, and the lifetime dose is 550 milligrams per cubic meter. Antimetabolites. They resemble normal metabolites needed for cell function. Once they gain entry into the cell division becomes impaired. Examples would be cytarabine, also called cytosar U, and ARA-C. The nursing implications, check the complete blood count before each dose. Review the signs of infection or bleeding, and instruct the patient to call the primary healthcare provider, HCP, for any temperature increases greater than 100 degrees Fahrenheit. Another example is fluorouracil or 5-FU. Check CBC before the dose. Nadir occurs in 10 to 14 days. Instruct about mouth care. And then the gemcitabine is also called Gemzar. Again, you want to check the CBC before each dose, pre-medicate with antiemetics, and instruct the patient to report flu-like symptoms to the primary healthcare provider. The next group is the alkylating agents, and these cause DNA strands to bind together and prevent the cell from dividing. So examples would be plantanol, also called cisplatin, and the nursing implications for this alkylating agent would be monitor neurologic status and kidney function studies. You'll pre-medicate with antiemetics, monitor for signs of anaphylaxis, and nadir occurs in 2 to 3 weeks. You will check the CBC before each dose and ensure adequate hydration to prevent kidney failure. The cyclophosphamide is also called Cytoxan, and for that one you will check the CBC before each dose. You will monitor blood urea nitrogen and creatinine levels. You'll ensure adequate hydration to prevent kidney failure, and the oral form should be taken early in the morning to keep the drug from building up in the bladder at night. The ifosfamide or IFEX has some nursing implications as well. You'll want to monitor the urine for blood, and it's given with Mesna, also called Mesnax, to prevent hemorrhagic cystitis. Ensure adequate hydration before and after each dose, and pre-medicate with antiemetics. Monitor CBC. The next agent group would be the antimitotic agents, and those come from plant sources, preventing mitosis from occurring in the cell, and then the cells cannot divide. So there's the docetaxel, also called Taxotere, and the patient must take dexamethasone starting 1 day before the scheduled chemotherapy to prevent hypersensitivity. This sounds like a bad one. Monitor the CBC, and nadir occurs on day 7. Monitor the weight, assess for skin changes, and watch for changes in neurologic status from baseline. Another example would be the paclitaxel nanoparticle albumin bound, which is Abraxane. And for that, you'll also watch for signs of hypersensitivity and monitor CBC and platelet counts. You'll watch for changes in neurologic status from the baseline, teach mouth care, and monitor vital signs for changes. The vincristine, which is also called Oncovin, the drug is a vesicant and should be given through a running IV. Assess for neuropathies and changes in neurologic status from baseline. Monitor CBC and platelets. There's also vinorelbine, also called navalbine or naval bean. The drug is a vesicant. When given through a running IV, use the port closest to the IV bag rather than the patient. Check CBC before each dose, and nadir occurs in 7 to 10 days. Teach signs of infection and bleeding. Monitor neurologic status and changes from baseline. Teach mouth care. There's also the topoisomerase inhibitors, and these inhibit enzyme topoisomerase to interfere with DNA synthesis. Examples would be the irinotecan, also called camptosar, and we want to teach measures to control diarrhea and patient to contact the primary HCP if it does occur. A dose of loperamide may be higher than normal. Verify that with the HCP. Check the CBC before each dose. The topotecan hydrochloride, also called Hycampton, we will monitor the CBC and pre-medicate for nausea. Some of the hormones that might be given would be our synthetic analog of luteinizing hormone releasing hormone, and this causes a decrease in the testosterone levels. And examples would be the leuprolide, also called Lupron. The nursing implication would be monitor prostate-specific antigen results. And then there are angiogenesis inhibitors, which block formation of new blood vessels to slow the growth and the spread of the cancer. Examples would be bevacizumab, also called Avastin. You'll want to assess for pregnancy and avoid administration after surgery. Also, sometimes that's what's given is monoclonal antibodies, and these bind to receptor sites on cancer cells to inhibit proliferation. The examples include alemtuzumab, also called Campath, trastuzumab, also called Herceptin, the gentuzumab called Mylotarg, the cetuximab, also called Erbitux, and then the ipilimumab, also called Yervoy. And for any of those, you'll watch for allergic reaction. Table 11.7, these are oral cancer chemotherapy medications. There's the tyrosine kinase inhibitor, which targets abnormal proteins on surfaces of some cancer cells to block the signals for cells to replicate. Examples are imatinib mesylate, also called Clevac, or erlotinib, also called Tarceva. Nursing implications would be supportive care for nausea, diarrhea, and tumor lysis syndrome. Monitor lab studies for decrease in white blood cells and platelet counts. Tarceva should be taken on an empty stomach to prevent raising the level of the drug in the body. Immunomodulating agent affects immune system function. Angiogenesis effect prevents blood vessels from growing, which prevents tumor from growing. So examples would be the lenalidomide, also called Revlimid. The nursing implications: pregnancy must be avoided due to the risk of serious birth defects, and you will monitor labs and electrolytes. An alkylating agent interferes with the ability of the cells to replicate, and examples include temozolomide, and also called Temodar. Nursing implications: monitor for white blood cell and platelet counts routinely and provide supportive care for nausea and diarrhea. There's also the anti-metabolite, which resembles normal metabolites needed for cell function. Once they gain entry into the cell, cell division becomes impaired. And this is used in metastatic breast, colon, or rectal cancer. Examples would be capecitabine, also called Xeloda, and the nursing implications would be monitor labs for red blood cell, white blood cell, and platelet counts, provide supportive care for diarrhea, nausea, and vomiting. And there's a number of hormones. Examples: antagonizes effects of androgen, that would be exemestane, also called Casodex. And for that, you'll monitor the PSA and liver function tests. Synthetic analog of luteinizing hormone releasing level causes a decrease in testosterone levels. We'll monitor PSA results. Leuprolide, also called Luprin, competes with estrogen for binding sites in the breast and other tissues to reduce breast cancer recurrence. Tamoxifen, also called Nolvadex, and anticoagulants increase prothrombin time, instruct patients not to take antacids within 2 hours of tamoxifen, and then reduces the amount of estrogen produced to reduce breast cancer recurrence. That would be the anastrozole, no, and anastrozole, also called Arimidex, and that should only be taken by postmenopausal women. Recommend regular bone density studies. And there's a miscellaneous agent that works by interfering with enzyme systems or metabolic pathways in the cells. Examples would be hydroxyurea, also called hydrea, and the nursing implications: monitor the white blood cell count, monitor metabolic panels for signs of tumor lysis syndrome, and monitor neurologic status and changes from baseline. So be safe, be vigilant. Oral chemotherapy pills should not be stored with other oral medications. They should never be crushed or broken. The nurse administering the pills should wear chemotherapy safety gloves. Side effects. Toxicities in patients receiving chemotherapy vary with the medication given. However, some general side effects are common to chemotherapeutic drugs because they all affect rapidly growing cells. Fast-growing epithelial cells, such as those of hair, blood, skin, and GI tract, are usually the most affected by both chemotherapy and radiation. Hematologic system. Chemotherapy is toxic to bone marrow, which is where blood cells are produced. The number of blood cells, especially white blood cells, drops after approximately 7 to 14 days of chemotherapy, depending on the drug. This period, when the cell counts are lowest, is called the nadir. This is when patients are most at risk for complications. Patients may develop low white blood cell counts, a leukopenia, increasing their susceptibility to infection and sepsis. Sometimes this is called neutropenia because neutrophils are the most plentiful white cells. A reduction in platelets, thrombocytopenia, increases the risk of bruising and bleeding. It can require platelet transfusions. Increased risk of anemia occurs with the reduction of red blood cells and may require blood transfusions. See Table 11.5 for medications that can be used to stimulate the production of these cells. Gastrointestinal system. Because the lining of the GI tract is made up of rapidly dividing cells, it is susceptible to the toxicity of chemotherapy drugs. Patients often experience nausea, vomiting, and diarrhea. Stomatitis, inflammation of the mouth, is a common complaint and is discussed under the side effects of radiation. These side effects can be controlled with medication. Hair, alopecia or hair loss is common with many, but not all, chemotherapeutic drugs. This is a temporary condition. Growth of new hair usually starts when the chemotherapeutic medication is stopped. Alopecia involves the entire body, including eyebrows, eyelashes, and axillary and pubic hair. Hair that regrows may be a different color or texture than the original hair. It is not uncommon for individuals who originally had straight hair to regrow curly hair. Reproductive system. The effects of chemotherapy or radiation can cause temporary or permanent changes in the reproductive system. Chemotherapy can damage sperm and ova. Be safe. Some websites promote icing the scalp to cause vasoconstriction and reduce the amount of chemotherapy affecting hair loss. Teach patients that this practice may not be safe. It may leave pockets of cancer cells in the brain and the scalp that are not reached by the chemotherapy. Issues concerning fertility should be discussed with the patient before treatment. Measures such as freezing ova and using a sperm bank can provide options for the patient and his or her partner. Patients should also talk to their HCPs before engaging in intercourse during chemotherapy and use protection against pregnancy. Neurologic system. Drugs may affect the neurologic system. An adverse reaction to vincristine or oncovin is neurotoxicity. This can result in tingling or numbness in the extremities. In severe cases, it can cause foot drop from the muscle weakness. Other systems, less common complications include renal toxicities, such as pain and burning on urination, and hematuria, which is blood in the urine. Doxorubicin, also called adriamycin, has been associated with permanent heart damage. Bleomycin, also called flanoxane, can cause pulmonary fibrosis. Severe toxic side effects can be controlled by carefully limiting the amount of each medication given and constantly monitoring the patient for complications. Learning tip. When assessing patients with possible side effects of chemotherapy and radiation, use the mnemonic BITES. The B is bleeding. Bleeding suggests there's a low platelet count. I for infection, which suggests a low white blood cell count and a risk for infection. T, tiredness, suggests anemia. E, emesis, places the patient at risk for altered nutrition and fluid and electrolyte imbalance. And then S, skin changes may be evidence of radiation reaction or skin breakdown. And so I'm going to pause. This is the end of part 2 for chapter 11, and I will pick up the next one on part 3 at cytoprotective agents. See if I can figure out. Oh, it's that'll be on page 161 of the book. Thank you so much for joining.